Guys, welcome back to Medical Coding with Blue. Today's episode is all about why new medical coders should wait 2 years before adding additional credentials to their name. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, first things first. I will say this first. The advice I'm going to give you today is just meant to help you, all right? If you choose to get additional credentials and disregard what I say, that is totally fine, guys. You have free will to do what you want. However, I will say this. I am speaking out about this because, and I have in the past, and I will continue to do so in the future. But I'm speaking out about this because I see a lot of schools and I see a lot of misinformation out there about new medical coders and, oh, you need to have all these credentials so that you can make yourself look good and you can be able to get your first job and all of these things. But what people don't understand is the more you tack on to your name, the more credentials that you have, the more continuing education units you will have to produce, and the more that you are going to be expected to know these things. Because just because you have a certification does not equal knowledge. Because if you are brand new and you're just able to study for an exam and then all of a sudden you've passed it and you have this additional credential on your name, it really means nothing in the terms of, okay, well, I have these additional credentials because I have experience, I have knowledge, I have know-how, I have competence. And when you're brand new and you don't have those things, it doesn't mean very much. It won't get you a job faster, my friends. You know, that's another misconception, is that, you know, if you have a bunch of credentials on your name that you're going to find a job faster. And that's just not true. Because I have, as a YouTube content creator for medical coding, I have the experience of having a lot of people write to me saying that, Blue, my teacher told me that I need to add on all these credentials to my name. I have 4 credentials and I still haven't been able to find a job yet. And I'm, you know, on the hook for another certification exam. So that's why I'm saying you can say no to adding additional credentials. And for some schools, they erroneously say, oh yes, we will prepare you for the CPCA and the CCS, and you need both of these to get out in the real world. The CCS, the Certified Coding Specialist, is a credential with the American Health Information Management Association. This is the Mastery Medical Coding Certification. It says that you have mastered inpatient coding and outpatient coding. This credential is for the person that wants the option of being able to apply for jobs that are inpatient for a hospital or outpatient for a clinic or something else, you know, some other freestanding clinic place. And so those are the things that you need to know about that credential. If you do not like to code for inpatient, the ICD-10 PCS portion, if you don't like to think about present on admission indicators or how to calculate MSDRGs, if that was just not your thing, you can always get the CCSP if you want to go with a HEMA. The CCSP is a Certified Coding Specialist physician-based. It is asked for just as much as the other credentials, but this just says that you are proficient in outpatient. You have mastered the outpatient coding. So you have the CCSP or the CPC. The CPC is a Certified Professional Coder, and that is a credential with the American Academy of Professional Coders. These are 2 separate organizations. The American Health Information Management Association is a nonprofit organization. The AAPC, the American Academy of Professional Coders, is a for-profit organization, meaning that they're going to sell you a product. It is a business. Both AHEMA and AAPC are both businesses. However, I will say that when it comes to just the amount of credentials that are out there, you know, there's only 4 main medical coding certifications that medical coding employers are looking for. There's the CCS, the CCA, the CCSP, and these are all with the HEMA, and of course there's the CPC, and that's with AAPC. Now, if you are having the degree designations, the RHIA and the RHIT, we'll get to that in a minute. And yes, if you're brand new, it makes sense if you have those degree designations and you want to get into the coding side or you want to have that background in coding, that makes sense to add on the additional credential of the medical coding certification, one of the 4. But for the most part, when you're brand new and you're not in a degree program and you are told that, oh yes, you need the CPC and you need the CCS, and that's how you're going to get your first job. You only need one. If you look in the job listings, it will tell you candidate must be certified with the American Health Information Management Association or the American Academy of Professional Coders. And that's all you need. Now, I have seen some ignorant job listings, and I say ignorant because they say, oh yes, candidate must have CPC and a CRC to be in a CRC position, which is Certified Risk Adjustment, okay? HCC, Hierarchical Condition Category Coding, they want you to have the 2 credentials. Now, let's see if this makes sense to you. Now, if you're already being tested on diagnosis coding with the CPC, and the CRC is basically just asking you more questions about risk adjustment, and it's still covering diagnosis coding, what sense does that make? If you've already taken the CPC, you're already showing proficiency in all of that. Why take an additional credential? Well, this additional credential is going to cost you more money. Is it necessary to get your first job? No, absolutely not. It is not necessary. I don't care what anybody says. I'm telling you because I have done my research. I have looked at these job listings. And is the pay comparable if they're asking you to be a CPC and a CRC? Absolutely not, because I've seen the pay scale on that too. And you're asking for additional credentials, and for what? And you're not paying more than somebody who's already earning with just one certification? Let's see if that makes sense, folks, okay? So back to what I'm saying about the CPC and the CCS. There's some schools and some programs out there that push both, that you need both. But if you do not want to do inpatient coding and you say this did not make sense to me, I just do not want to do this, you don't have to take the CCS. You can take the CCSP instead, the Certified Coding Specialist Physician Based. You can take that instead of the CCS. And when they say that they're preparing you for the CPC, that's also good enough to prepare you for the CCSP. Now, the CCSP does go into depth on other things, but you can go to the AHIMA website and look at the domains for the CCSP and see where you need to supplement your learning, okay? You do not have to be a slave to all the things that people are telling you. You all need to start doing your research, because there's a lot of like, oh my gosh, there's so much information out there. A lot of this can be cleared up simply by going to the association websites themselves when they're talking about the credentials. But what I'm telling new people is all you need to start is one. If you take the CCS first and you say, okay, well, I passed it. This says that you can go to inpatient or outpatient. This is the only credential in medical coding that you need. You do not need to add a CPC to be more competitive. The CCS says that you are more than competitive and you are more than able and capable of working anywhere, okay? So it is not worth the burden or the money to have to add on additional credentials from another association, because AAPC does require their members to be members every single year. And not only that, it's a $205 charge currently, right? And every single year that you have that credential, you have to pay the membership fee. And on top of that, you have 2 years to come up. If you have only one certification with them, that's 36 continuing education units for just the one CPC. Now, if you have the CCS, it is 20. And it's not a big deal difference like, oh, well, AAPC, they require more, so it must be better. No, it is not better. That is an association thing. And remember, guys, AAPC is a for-profit organization. I'm not trying to put them down. I'm trying to give you the facts. They are a for-profit organization. They have to make money. Whereas AHIMA is a non-profit organization, okay? So their business model looks a little bit different, okay? And again, if you have the CCS, this is asked for in 99% of the job listings that I see. And anytime I've seen them only ask for a CPC, I can immediately tell that that person has something against the other organization and that they don't want that any other organizations. They only want AAPC. And to me, that is ridiculous, because if you can pass a CCS, a CCA, or a CCSP exam, that knowledge is just as good, even better sometimes, because inpatient, if you're taking the CCS or the CCA, and it's equivalent, guys. It is equivalent. And so that's the thing that you have to understand. You do not have to have more than one certification. It will not get you hired faster, and it definitely will not get you more money. Now, before somebody says, oh, at my facility gets you, okay, please, sit down, okay? You know why? Because when you're brand new and you're trying to get your first job, that is the last thing that is going to be on the table. Well, I have multiple credentials, so I'm going to make more money. No, you're not. You are going to start out at whatever new medical coders who have no experience start out at. That's what you're going to start out at. And we don't talk about money and specifics on my channel, and I never have and I never will. But if you go to the Department of Labor or the Bureau of Statistics, it will tell you in your local area what medical coders make. And no, I won't leave the link because I already told y'all where to find it. You can find it by Google. Okay, it's very easy. So do that so that way you can do your research. But again, don't get hung up on the money. I've already told y'all this. When you get hung up on the money, because medical coders make good money, that goes without saying. And if you say, oh, no, I saw it was, okay, then you're looking at the wrong thing then. I'm just telling you. But when you are out there and you're trying to get your first job, let's just concentrate on one thing at a time. Because the more additional credentials that you add on, the more you're going to have to find more CEUs to cover those certifications, okay? So that's the thing that you need to know. Now, as I said in the beginning of the show, if you have the RHIA or the RHIT and you're going through the degree program, it is natural to get a medical coding certification in conjunction with. So even though you have no experience, whatnot, you can still get both of those, and that is fine. The reason that I say that that's fine and that's something different from, just being a regular medical coder, because again, with the degree programs, these are for our leaders. The RHIT, the Registered Health Information Technician, this is from the Associate's Degree Program. So if you go through the Associate's Degree Program for Health Information Technology, it's helpful if you have a medical coding certification. You don't have to, but it is helpful because the medical coding portions of these programs a lot of times is very short, or it's not a lot that's covered. They need to give you the broad strokes of the medical coding side, because mostly the degree programs are concentrated on compliance. They are concentrated on the human resources side of the house and managing the whole department. That's what their programs are designed for. So it does help if you have a medical coding certification, because when you do, this says that you're competent in the coding portion, which is separate from the main duties of the degree holders, okay? If you have the RHIA, it's the same thing that I would recommend. I would recommend that you go ahead and get the medical coding certification, because if you're going to be head of a department, then you need to have that knowledge backing, so that if you are called upon to be the tiebreaker between two coders, or an auditor and a coder, or an auditor and a supervisor who can't agree on an answer, you need to be that tie-breaking person, and you need to be competent in what you're doing. There's no excuse for leaders not to be competent fully in what they're doing. There's no excuse for that, especially because there are so many options for learning medical billing and coding. So that's what I would recommend. But I implore new people to refrain from trying to keep up with the Joneses, because I see that as well, is that a lot of new medical coders are saying, well, so-and-so got all of these credentials and I want to be just like them. Why? Having a bunch of credentials means nothing. I have seen people, veteran people and brand new people, with a slew of credentials, and they are incompetent. And they are some of the most incompetent people I have ever come across in medical coding. So it doesn't always mean anything, guys. It's not always impressive, all right? It's the same thing if they have just a degree designation, RHIA or RHIT. It doesn't necessarily mean that they understand what they're doing. Not everybody understands what they're doing, and not everybody cares. Because again, some people are after it for the money. And if that's your thing, I won't tell anybody. But to me, that's just the wrong way to get into this industry. This industry means a lot to a lot of people. And it is so important, the data that we're able to collect. And that information is power, and it's able to come up with all kinds of statistics for the health of the population in your area. And being accurate goes a long way into helping those people. And not just that, guys, when you are coding something, at the end of the day, it comes down to that patient is going to get billed for everything that you're submitting. And their insurance is going to have to pay. They are going to have to come out of pocket for the rest. And if you are not coding properly, that's a problem. And you can code properly or improperly with one or a plethora of credentials. So again, all of these credentials means nothing if you have no experience to back it up. That's just what I'm going to say about that. And I'm not against taking classes to learn things. If you need to learn about billing and you're a biller and you went through the coding course and you did billing, of course, in your coding course, and it didn't sink in, so you want to take a supplemental course, and they say, oh yeah, at the end you could take your CPB. You don't necessarily have to take the CPB, because is anybody asking for it? No. And so that's the thing that you have to understand. It's okay to take the class, but you don't have to get on that added expense of another roughly $400 to take a test, okay? And so it's a little bit more if you're going to take the 2 attempts. So, but I can't think of the cost off the top of my head. But that's the thing that you have to understand. And people are going to push these things because they're salespeople. And they're going to try to sell a program. And they're going to try to get their money, because at the end of the day, that's what it is. There's people who sell. And that's what they're designed for. And if you are not doing your research, you will be taken advantage of. All right, and I don't like to see anybody taken advantage of. It literally makes me mad when I see that, because people are just not doing their research. And if you're going to get taken advantage of, that's just terrible. It's a terrible thing to have happen to you. But again, you have to be responsible enough to say, you know what, I'm going to be the discerning consumer, and I am going to make sure that I do my research on, do I need this? I'm going to look in my area and see what employers are asking for. Which certification are they asking for the most? If I see that they're asking for the CCS, and I can do this, I can study for this exam because my program prepared me for either or, you know, I'm going to go ahead and go for it. I'm going to go for that CCS because I want to give myself more options. CCS is the Mastery Medical Coding Certification, and it is no picnic. It is a 4-hour exam where the majority of that exam is going to be your coding knowledge and skill. And so again, if you are not practicing with the books like you're supposed to, if you are not doing the work, the reading of the coding guidelines and all of those things, if you're not doing those things, guys, the result is going to be exactly what it is when you get done taking that test, because it's going to be a crapshoot if you pass, rather than if you just actually sat down and started working with the books and started working with the workbooks that are in the description box below, that I have talked about several freaking times. They're all there. And if you go through and you practice with those, you'll get more proficient with the coding. So that way you can be prepared when you're out there. And for those of you who say, well, you know, I get all these credentials so that I can have the best shot at getting in. The person who has the best shot of getting in is a person who has one certification, who has the tenacity to go after these jobs, even though they're asking for 3 to 5 years of experience. Because a lot of people will see that the employer is saying must have 3 to 5 years of experience, and they will immediately not apply because that's, you know, oh, they want all this experience. But if there are qualified coders in that area and they are not applying for that job, and that employer gets desperate, and you're the only one who had the nerve to show up and say, hey, I have my CCS or I have a CPC and you know, I'm here to apply for this job because I've been studying, I've been doing all these things. And well, okay, well, we'll go ahead and give you a test. And if you can pass that test, well, there you go. And then you have a better shot of getting in than the person who immediately takes no for an answer or is so shy. This is not the time to be shy. And this is definitely not for, this field is not for those who are weak at heart either. You know what I mean? Like, you have to be in there and you have to get in there, and you're going to get rejected. That's going to happen. And it even happens to people who have a slew of credentials after their name. Okay. And what happens if you're getting all these credentials and then you get in someplace and you decide, this isn't for me, I don't want to do this? Then you just wasted all of that money in less than 2 years because you were trying to make all of this money because of what somebody else told you. So, something to think about, right? Wait 2 years. It won't hurt you. It won't hurt you. Get your CCS or get your CPC first. Either one. Either one. You can get your CCA instead, or you can get a CCSP. Any one of these, and look at what those credentials are covering. Let's just say you get the CPC, and then you decide in 2 years, you know what, Blue? I really like AAPC, and I want to stick with them, and I want to do inpatient coding. Should I get the CIC? Absolutely, because it's been 2 years, and not only that, you discovered you really like it. And you've had all this time to study. So go ahead and sit for your CIC. Well, Blue, I have my CCS. And I discovered in the 2 years that I've been doing this, because I've had time to develop and learn all this stuff, that I think I want to pursue CDI. Then by all means, CDIP, with the HEMA. And that's open to anybody, But that's the thing. You have to look at the requirements. Look at the requirements on the website, guys. ahima.org, ahima.org. And that will have given you enough time to develop and enough time to get used to the requirements of the CEUs and to know if you really do like this, that you want to continue to pursue it. That's something to think about, guys. And it's just like those who ask me, Blue, should I go and get my degree? I just got my certification. Not if you don't want to get into leadership, not if you don't want to become an auditor or any of those things, or a lead medical coder. If you don't want to do any of those things, a manager, a department head, if you don't want to do any of those things, don't pursue the degree, guys. It's not worth it because that's not what you want to do. Now, if you want to do those things, if you can see further on down the road that, you know what? I think I want to pursue that. Well, guess what, guys? If you're already working, your employer may have tuition reimbursement. So let's think about that. All these people that are going on and saying, oh, I'm in all this student loan debt and blah, blah, blah. Who put themselves there? You did. Because you thought that that's what you needed. Instead of using the tools that are out there for everybody. If your employer has tuition reimbursement, you take advantage of that. And then you say, you know what? I want to go into leadership. I've been in a coding position for 2 years, and I think I want to do this. I want to be a lead medical coder. I want to go back and pursue my degree. Okay, well, here's the money for your tuition reimbursement. Boom. And there you go. And your employer's paying for it. And your out-of-pocket expense is going to be nothing or lower. Or a little bit. Rather, not lower, but a little bit than normal. Okay? There's no need to be getting into all this student loan debt when you don't need to, okay? And if you don't want to pursue additional schooling, then don't. But that's something that you have to understand, that this is going to require you to be continuing educated, okay? So that you have to know. But keep yourselves from getting any additional credentials in the first 2 years, okay? Unless you have a degree already. But if you have a medical coding certification, start off with one. Keep it for 2 years, get your first job, get in the door, find out if you like it, and then move on to additional credentials. But don't feel pressure to have more than one credential, because if you look in the job listings, it'll tell you 99.999% of the time, all you need is one. Of course, there's always that 1% that thinks that they know, but I would never work at that organization. Never. Anyway, with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.